Did you know that pulmonary fibrosis can be linked to bone marrow failure syndromes? Struggling to breathe and fighting low blood cells? It might be PF plus bone marrow failure. It's a fascinating and complex relationship that we're about to explore. But before we dive in, let's ponder a couple more questions. Can you imagine a disease that affects both your lungs and bone marrow simultaneously? It's a double whammy that's as intriguing as it is challenging. And what if we told you there's a condition called Dyskeratosis Congenita that combines these two? It might sound like a mouthful, but it's a reality for some. So, are you ready to embark on this journey of discovery with us? Stay with us as we delve into these intriguing medical topics. Rare combination: unveiling the mystery of PF and bone marrow failure. Pulmonary fibrosis is a lung disease that occurs when lung tissue becomes damaged and scarred. This condition can make it more difficult for your lungs to work properly, and the damage can be irreversible. Now, let's consider bone marrow failure syndromes. These are a collection of disorders characterized by the bone marrow's inability to produce enough blood cells. This can lead to a host of health problems, as your body relies on these cells for oxygen transport, clotting, and fighting off infections. At first glance, these two conditions might seem unrelated, one affecting the lungs and the other the blood. However, intriguing research suggests a surprising connection. This link lies in the realm of genetics, specifically in mutations of telomerase components. Individuals with both conditions are often found to have these mutations, painting a fascinating picture of how our genes can influence our health. These two conditions might seem unrelated, but research suggests a surprising connection. Don't ignore these symptoms. Learn about PF plus bone marrow failure. Diagnosis of these conditions involves a series of tests, including genetic testing. The process is like putting together a puzzle. Each piece offers a clue to the bigger picture. Now let's talk about the signs and symptoms. They can be quite varied, but some are more common than others. Shortness of breath, for instance, is often one of the first signs of pulmonary fibrosis. It's a feeling of being unable to catch your breath, even when resting. This can be accompanied by a dry cough that just doesn't seem to go away. Then, there's the fatigue, a common symptom in bone marrow failure syndromes. Patients often describe feeling tired all the time, regardless of how much sleep they get. This is because the bone marrow isn't producing enough healthy blood cells to meet the body's needs. Another symptom that may be present is a rapid heart rate. This happens as the body works harder to deliver oxygen to its tissues. It's like your heart is constantly running a marathon without the finish line in sight. The symptoms of these conditions are often subtle and can be easily overlooked, making awareness and early detection crucial. These conditions are relatively rare, affecting only a small percentage of the population. The incidence rate, while low, is a testament to the indiscriminate nature of these syndromes. They don't favor a particular gender, with the male to female ratio being fairly balanced. Despite their rarity, they can affect anyone, regardless of age or gender, and can significantly impact the quality of life. The survival rate varies, influenced by several factors, including age at diagnosis, overall health, and access to treatment. Though the survival rate varies, advancements in medical science are continually improving the prognosis. Understanding pulmonary fibrosis and bone marrow failure syndromes can be a lot to take in. We've explored their definitions, how they are diagnosed, their signs and symptoms, and even dove into some statistics. The connection between these conditions and genetic mutations in telomerase components is a significant discovery, impacting future treatments, particularly in bone marrow transplantation. It's vital to remember that these conditions affect real people every day, and by sharing what we've learned today, we can increase awareness and understanding. Knowledge is power. By spreading awareness, we can help those affected by these conditions lead a better life. Like, share, comment, and subscribe.